The Octa research team says prioritizing the vaccination of Metro Manila residents will help the country achieve herd immunity faster. AstraZeneca defends its jab amid reports of extreme side effects like blood clotting. The vaccine maker says the shot still provides more benefits than risks. The DOST is now looking at international studies that says mixing different vaccines might actually make it more effective. The Labor Department is looking to hire more contact tracers, saying current efforts seem insufficient. But some tracers say the problem mostly lies with dishonest close contacts. And after Taylor Swift, the kings and queens of K-pop gear up to take us back to simpler times. That's with 2NE1 and Big Bang reportedly staging a comeback. Focused, fearless. Here's everything you need to know to jumpstart your weekend. I'm Jess De Los Santos. The Octa Research Group says vaccinated 35 million Filipinos might be enough to achieve herd immunity. But that's only if we prioritize vaccination efforts in Metro Manila. Greg Gregorio with the story.
The country might achieve herd immunity sooner than expected. That at least is according to the Octa Research Group. From the regional estimate of 70% of the population at 70 million, that may be trimmed to 35 million or 33% of the population. But as they told the chiefs, there is a catch. This number should include 75% of Metro Manila's population.
If we could get sufficient, maybe 5 million, 3 to 5 million vaccines in the NCR, malaking matutulong yan. Especially since NCR is the highest risk, it's also the economic center, and everything also goes through the NCR. So if we can control the surge in the NCR, and if we can prevent outbreaks in the NCR, essentially we'll be almost preventing outbreaks in other regions.
Herd immunity is when enough members of a community is immunized so that a virus is no longer able to spread. According to Octa, this is easier to achieve in some regions like Bicol and Ilocos, both barely touched by the virus. These areas, David said, could afford to inoculate even just 20% of their population. The health department will look into Octa's study. The agency said there is no certainty yet as to when herd immunity will be achieved, given the lack of supply and the lack of study on how long a vaccine provides protection.
And our basic objective is for us to reduce deaths. Kaya nga po, ang ating prioritization is naka-base on the vulnerable. If you vaccinate these individuals and mauna sila, maprotektahan natin sila, it can avert this number of deaths in the population.
For News 5, Greg Gregorio, we are One News.
But there are still some challenges to ramping up vaccinations in the metro, including vaccine hesitancy even among frontliners. In Parañaque, around 10 to 15% of health workers are still hesitant to receive COVID-19 vaccines. In an interview with One News' The Chiefs, Parañaque Mayor Edwin Olivares said that all registered frontliners have already been vaccinated. However, he said there are still at least 10% who refuse to sign up due to mixed reasons like distrust and brand preference.
Lahat po na naka-register na frontliner po sa amin, tapos na. Tapos na po siya. Lahat na nag-registered online. But until now, meron pa rin po kami continue sa ating mga health frontliners. Po yung mga BHW natin, yung mga city health worker, yan po yan. Basically, pero yung mga nurse, doktor, lahat ng akin nakausap, halos 100% okay po sila.
Citing reviews from European health regulators, AstraZeneca defends its COVID-19 vaccine, saying it offers high level of protection against the virus. AstraZeneca said reviews from UK's Medicines and Healthcare Products Regulatory Agency, as well as the European Medicines Agency, reaffirmed that the vaccine's benefits continue to far outweigh its risks. The company said both agencies have completed their assessment of the extremely rare blood clotting events with low platelets from over 34 million people vaccinated in Europe. But they noted that the reviews did not identify any risk factor as a definite cause for these adverse effects. For its part, the country's Food and Drug Administration still believes that the vaccine remains safe for senior citizens.
Clotting and with thrombocytopenia was not seen in people 60 and above. So yung mga in-investigate na cases are actually in people below 60. So yung 60 and above, definitely sila yung pinaka magbe-benefit sa bakuna, sila yung pinakamataas ang risk at for getting COVID-19 and dying from COVID-19.
With the recent suspension of AstraZeneca vaccinations, the DOST is looking into international research on the efficacy of mixing COVID-19 vaccines. The agency says there are researchers from the US and Europe who explore the possibility that mixing vaccines might have an even better result than getting 2 doses of the same shot. MMDA Chief Benhur Abalos urges the national government to extend the deadline of the government's cash aid rollout. Abalos said the 15-day deadline given to mayors will be hard to comply with as LGUs are already spread too thin with vaccination rollouts and implementing COVID-19 precautions and restrictions. Quezon City Mayor Joy Belmonte earlier appealed for an extension of the said deadline, citing the large number of beneficiaries in the city. The mayor added that she does not want these distribution days to become, quote, super spreader events. Abalos also said LGUs would need a longer deadline if they were to adopt a house-to-house distribution method to limit contact and virus transmission risk.
There should be an extension, but if we're going to make it house to house, it will really need a long extension because it will mean a lot of efforts right now. The employees right now on the ground are having quite a hard time. That's the problem. It's the time limit. So the mayors, aside from having this vaccination on their hands, aside from having this isolation, aside from having this quarantine, granular lockdowns, tracing, testing, their hands are really full right now.
As COVID-19 cases rise, the Labor Department eyes hiring more contact tracers to meet demand. But tracers lament the dishonesty and non-cooperation of some close contacts. Jenny Dongon with the details.
Since the onset of the COVID-19 pandemic, health experts have time and again emphasized the crucial role of contact tracing in containing the virus. And now that we're seeing a spike in cases, the government is scrambling to meet the demand for contact tracers. Hannah Catameo, who has been a contact tracer for 9 months now, admits that her job is not easy. One problem is the dishonesty of some close contacts.
Usually po, hindi po sila nagka-cooperate, then hindi po sila nagpapaano sa bahay, nagbibigay din po ng info since ayaw po nila. Privacy daw po nila yon. Nakaka-affect po siya kasi parang meron po kaming missing part sa line list po namin na hindi po namin bibigay. Hindi po namin napupuntahan kung sino po yung mga close contacts nila, hindi po namin na-endorse. If ever po taga-ibang city yung close contacts nila, hindi po namin na bibigay yung info para mapuntahan din po ng ibang seso.
She says even contact tracing forms in establishments are not exactly helpful as some still don't take it seriously.
Naglagay po ng pangalan ng artista, pangalan ng characters, ganun po. So, parang saan po namin nahanapin po yun, di ba?
On the average, from February 28 to March 29, the contact ratio in the Philippines was cut down to 1:3 from 1:7. This means that each tracer was only able to reach 3 close contacts of a positive case. This is far from the ideal urban setting, which should be between 1:30 and 1:37 ratio. According to the World Health Organization, the ideal contact tracing ratio should be 1:800. At such a rate, which more or less 100 million people in the Philippines, we need to have 135,000 contact tracers, a far cry from the 15,000 rehired by the Interior Department as of January this year. For its part, the Labor Department has been assisting the LGUs in hiring contact tracers, especially in NCR, a COVID-19 hotspot. The agency targets to hire 14,000 displaced workers as contact tracers for a month under the TUPAD or Tulong Panghanap Buhay sa mga displaced workers.
Kailangan lang naman po ng ating contact tracers ay merong basic knowledge sa paggamit ng telepono at sa paggamit po ng internet.
Trivilla adds that the program will help provide a temporary living for displaced, underemployed, and seasonal workers. Once hired, tracers will be given modules to properly communicate with close contacts. Hired tracers are expected to earn more than 500 pesos a day under the program. For News 5, Jenny Dongon, We Are One News.
It's not just Taylor Swift bringing us back to an earlier time when we all had simpler problems. K-pop groups To Anyone and BIGBANG are reportedly recording new music, effectively sending stans into a frenzy. In an interview with KBS, a former member of K-pop legends To Anyone revealed that the group has recorded something together 5 years after they officially disbanded. But Park Bom said she's not sure if or when it will be released. Meanwhile, G-Dragon, leader of K-pop group BIGBANG, said in an interview that he's working on a new album for the group. After a long hiatus while the members served their mandatory military enlistment, BIGBANG was supposed to stage a comeback in last year's Coachella before the entire event was canceled due to COVID-19. These two groups last released records in the late 2010s, and now that they are seemingly gearing for a comeback, fans worldwide can hardly wait. And those are the top stories of the hour. Join us later at 10 in the morning as we continue to monitor the day's biggest stories. You can also catch One News on the Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. Mask on, wash hands, and stay safe, Philippines. I'm Jess De Los Santos. We are One News.